Welcome to the MQ Health Wellness series on infection prevention, safeguarding patient health in healthcare settings. My name is Gemma Chang. I'm the Infection Prevention and Control Specialist at MQ Health. So I would like to start by acknowledging the traditional custodians of the land on which I'm presenting from, the Wadawurrung clan of the Darug Nation, and I pay my respects to elders past, present and emerging. So I'd like to start off talking about healthcare-associated infections to understand how to prevent healthcare-associated infections and safeguard patient health in hospitals and healthcare settings. So we'd start to talk by what is a healthcare-associated infection. These are required in healthcare facilities and caused by healthcare interventions, and they may become evident after a patient has been discharged from a hospital or after they've left the healthcare setting. It is estimated that there are 165,000 cases of HAIs per year annually, and unfortunately resulting in 7,500 deaths. They're caused by infectious organisms that live on surfaces, objects, walls, sometimes living on the human body without causing harm. When they do cause harm to a patient or a person, they need a vulnerable and susceptible host and a portal of entry. This may be a wound from a surgical incision, invasive device from indwelling catheters, and perhaps an IV cannula. Unfortunately, some hospital acquired infections or healthcare associated infections may be more difficult to treat due to the rise in multi-resistant organisms. This is what you may hear on the news referred to as superbugs. You may also have heard the term in Australia as MRSA, or MRSA in American terms is a common healthcare associated multi-resistant organism. This is also due to the rise of antimicrobial resistance, or bugs that can remember antibiotics that we have on hand and render them ineffective. So to explain what a multi-resistant organism is, I just need to elaborate on the term antimicrobial. Now, this is an umbrella term for medicines that work to treat an infection. You may have heard of terms such as antibiotic, antifungal, antiviral, the list goes on. Of course, I need to delve into a little bit of history so you can get some understanding as to how multi-resistant organisms occur. So for most people, everyone will know that the first antibiotic was penicillin. This was identified in the 1940s. In 1944, some strains of Staphylococcus aureus begin to emerge. You might also know this term as golden staph. And some of these strains of Staphylococcus aureus became resistant to penicillin. Hospitals during that time, specifically in the 1960s, found something called methicillin, which they sprayed into hospital air to try and reduce colonization or organisms that are living in the environment on the surfaces. And this provided immediate results which reduced the rate of these infections in hospital. However, then clinical isolates of the MRSA or MRSA, methicillin-resistant Staphylococcus aureus, was first identified in 1961, leading to ongoing hospital outbreaks of infection. So MRSA, as I said before, is the most common multi-resistant organism in a hospital, and they're often resistant to many other antibiotics that are available. To add why multi-resistant organisms is such a huge threat, it's identified as one of the top 10 global health threats as identified by the World Health Organization. There's been no new discoveries of antibiotics or significant ones in the past 2 decades, so we are running out. So antimicrobial resistance, big word, but this occurs when bacteria, viruses or fungi stop responding to the medicines that work to kill them, such as antibiotics for an example. This works in 2 mechanisms. So part of the DNA of the organism remembers the antibiotic and carries what's called as a resistance factor. This passes information on to other bacteria or to closely related cells with structural similarities. After taking antimicrobials, sometimes a few bacteria will survive, and they build up a resistance by having a special trait which allows these medicines not to access the entry point of the organism, therefore rendering them ineffective. So when your healthcare professional says to you, please finish this course of antibiotics, make sure you listen to their instructions and follow their advice. And also, please don't save leftover antibiotics for future use. This can drive antimicrobial resistance. So some patient-related risk factors. So poor immunity, particularly in the very young or the elderly, that are specifically immunocompromised. And chronic disease, breaks in skin integrity. As I said, we need additional ports of entry for infections to occur. Smoking adversely affects patient immunity, and high-risk surgeries, especially those involving foreign bodies or prosthesis, like knee or hip replacements. Your travel history, so particularly if you're traveling to countries with high burden of infections, and some of those infections are not common or current in Australia. Residing in areas that have different types of organisms. So an example, if you live in tropical Darwin as opposed to metro Sydney, there will be different organisms. If you've got an invasive device, particularly over a long duration of time, we see urinary tract infections a lot from indwelling urinary catheters, for an example, and they are the most common hospital-acquired infection or complication. Prolonged stays in hospital. Generally, hospital and healthcare facilities do have a lot more resistant organisms than elsewhere. And prolonged stay in intensive care units, so that's specific as well with the use of mechanical ventilation, which can lead to pneumonia. So here are a few types of infections, some that I've already touched on: urinary tract, gastrointestinal tract, so poor food handling practices, antibiotic usage, which is prolonged, can cause something called Clostridioides difficile. Surgical wounds, as I said, that port of entry, pneumonia with the mechanical ventilation. Bloodstream infections are a huge one, usually secondary infections from a primary site. Skin affecting compromised integrity and newborns, and anyone that's immunocompromised. Not to mention acute respiratory infections, as we've seen with the pandemic, and seasonal influenza. So what can someone do to prevent a HAI, and what can clinicians do? So as a patient, if you detail and provide an accurate health history to give to your provider, so they can assess any risk factors that you may have and implement strategies to mitigate infections. So this may include, if you're going to surgery, some decolonization techniques, or reducing the bioburden of those organisms, reducing the amount that are living on your skin, so there's less chance that you can get an infection. This is usually done by special pre-surgical wash. And if you don't have a multi-resistant organism, just having a neutral soap wash prior to your surgery. And just as I said before, following the advice of any healthcare professional that is providing antimicrobials to reduce that drive in antimicrobial resistance, and making sure you understand the reason why you're being prescribed antibiotics, understanding how to use them, and questioning and confirming your understanding with your healthcare provider. Wear masks when you're ill or potentially exposed to respiratory illnesses, and attend hand hygiene. So hand hygiene is the single most effective preventative measure to reduce the bacterial numbers on your hands. Your hands can transfer organisms from objects to other people to yourself. And being aware of any isolation or precautionary measures when you go into healthcare facilities. You'll see some signage on some doors. And if you have been told you've got a multi-resistant organism, just doing those decolonization techniques. So there would be some things that you would be told about: washing your bed sheets before coming into surgery, doing some extra showers before coming in, and just also knowing what kind of wipe to clean your environmental surfaces detergent versus a disinfectant. A disinfectant is a biocide that will work to reduce and kill bacteria. So some strategies. As an inpatient in hospital, you may be isolated depending on what organism you have. It would have to be a multi-resistant organism usually, or a respiratory infection. And this signage on the outside of the door that would allow your clinicians and any visitors to put the appropriate personal protective equipment on. You may ask to wear a mask in hospital if you can medically tolerate, and the single room, I should say, would be dependent on availability. Not every hospital has all single rooms. For any other healthcare interventions, you would expect to get education about the type of infection you have, hand hygiene, and what kind of antimicrobial you've been prescribed. You'd expect that you would have a swab or a test to confirm what kind of bacteria or virus or microbe you have causing your infection, and potentially you may get an antibiotic prescribed until the result of the outcome of your swab, and then you may get another antibiotic prescribed that is more specific to that infection. This is what a healthcare prevention strategy that would be in place at all times, called standard precautions. Your clinicians will always be practicing these whatever healthcare facility you go to. That's hand hygiene, the use of PPE, the safe disposal of sharps, environmental cleaning, cleaning your stethoscopes, your blood pressure cuffs, and sterilisation of reusable medical devices in surgery, respiratory cough etiquette, aseptic technique, linen and waste handling. If you're in hospital, you may see some signs such as contact precautions. That's for your multi-resistant organisms that we've spoken about. So it goes through what PPE is required and what kind of clean is required as well, with those standard precautions always in place at all times. Droplet precautions, this would be for your seasonal influenza, and they just now would add on a surgical mask. For your airborne precautions, you take away the surgical mask, now we're adding on a respirator, so your P2 or N95 masks. You may be put in what's called a negative pressure room that kind of works as a vacuum to make sure that the air isn't dispersed to outside areas that may cause infection to other workers or patients. So just some stats about infection prevention and control programs. So globally, only 1 in 10 countries do not have an infection control program in place. This is a study from World Health Organization, or a survey I should say, from 2020 to 2021. So out of all of them, those dark green countries there are the 31 out of 162 countries that responded that have full implementation in place. So Australia being one of them. So what that means is an IPC program in place that's set up by the World Health Organization core guidelines for infection prevention and control. They also have compliance and monitoring, and the effectiveness of this is regularly evaluated and published. So plans to update and respond to these monitoring are also undertaken. In this report as well, as I mentioned before, hand hygiene being the single most effective measure, the World Health Organization also said this and other cost-effective practices, such as those precautionary signage that I mentioned earlier, have 70% of infections can be prevented by implementing those. So prevention is much more important than control. So lastly, we have the consumer transparency. A current web tool was recently developed by the Australian Commission on Safety and Quality in Healthcare. You might know this as the Commission, to assist consumers in making informed decisions about their healthcare, and also providing transparency about how you would feel safe if you were to attend that hospital. It also drives hospital improvements and accountability if they provide this transparency. So all public hospitals and private hospitals that opt into this tool have 3 indicators in place that you are able to look at. So one of them is assessment against the National Safety and Quality in Healthcare Service Standards, and this provides accreditation to the hospital to continue operating to ensure that they meet quality and improvement standards. The National Hand Hygiene Audit results, and your Staphylococcus bloodstream infection rates. So if you go to safetyinhealthcare.gov.au, you can look up the hospital that you would prefer. So that concludes this presentation, and I hope you learnt something new today. Thank you.